Thank you for joining us today for our webinar discussing how to revolutionize your payment process. My name is Tony Peterson, and I am joined today by Monica Peterson. We will be your hosts for the webinar. And my position at NexTrust is I'm the Vice President of Customer Experience. Monica is one of our outstanding implementation specialists who helps train and onboard our customers so that they can effectively utilize the BillFlash system within their practice. So if we could go to the next slide, Monica. In today's webinar, we are going to review the following items. We're going to talk about different payment trends in healthcare. We will then transition and speak about how to effectively implement SelfPay for accepting online and mobile payments from your patients. After the SelfPay discussion, we'll review how to automate your billing and payment processes using BillFlash Pay Services. And then finally, we'll wrap up with some best practices for promoting SelfPay to your payers. Go to the next slide, Monica. So we'll start off with going through the payment trends in healthcare. So what do patients want? They really are looking for a seamless digital experience. During the pandemic, people became used to having digital options wherever they go. They don't want to go back to doing everything manually, and they're willing to find someone who will make the check-in and payment process simple for them. In fact, 22% of patients who consider themselves loyal to their current physician stated that they would switch to a different office that provided better digital communication tools. Think about what that means. 1 in 5 loyal customers. This isn't just average patients or average customers. Out of most loyal customers, 1 in 5 of them would switch to an office that provided better digital communication tools. That is a huge number and important if we're wanting to stay financially viable as a practice. 65% of patients have said they would change providers to those who better meet their billing preferences. And 91% of all healthcare consumers prefer electronic payment methods to pay their medical bills online. The world of healthcare has changed significantly over the last 10 years, and even more so over the last 5, as you can see there. Next slide, please, Monica. 83% of physicians report their greatest challenge is slow patient payments. You can overcome this by providing a painless payment experience for your patients. You need to make it easy. You need to make it easy for your patients to pay, and the less that they have to think about it, the better. Patients are acting more like consumers, and what consumers want is convenience. You look at how Amazon has changed the world. Quick and easy to use payment options must also be safe and secure. You need to make sure that your patients are aware of their payment options. Offering convenient payment options for patients can help increase the practice cash flow by making it easier for patients to pay their medical bills. By offering an online payment portal through BillFlash SelfPay, practices can make it more convenient for patients to pay their bills and reduce the risk of missed or delayed payments. This can help to improve the practice's overall cash flow by increasing the number of timely payments that are received. Additionally, offering convenient payment options can also help to improve patient satisfaction, as patients are much more likely to pay their bills when it is easy to do so. This can lead to increased patient retention and potentially even new patient referrals for your practice. You really need to communicate with your patients where they already are, on their phones. 85% of all consumers check their text messages within 1 to 5 minutes of receiving a text. 32% of all people will pay their medical bills within 5 minutes of receiving an electronic notification via text or email. Imagine if you were able to send out that text or email and they saw it, 32% of your patients would pay immediately. That can significantly increase the cash flow and the financial viability of your practice. So now I'm going to turn the time over to the much more talented Monica, and she'll take you through and help you understand how BillFlash can help you adapt and take advantage of these trends using technology.
Wonderful. Thank you, Tony. Tony mentioned earlier, my name is Monica Peterson, and I am one of the implementation specialists here at BillFlash. So my responsibility is to train a new customer and then also go over all the features that they will be using and make sure that they understand what those features are for and how to use them. And so we are going to address your questions today after this meeting, but before we do, I would love to go over the feature SelfPay as well as our feature AutoPay, both of which are very helpful in collecting patient responsibility in a timely manner. Our SelfPay feature is accessible, as Tony said, from a laptop, computer, a tablet, or a phone. It's just extremely convenient, especially for busy professionals like yourself. The SelfPay feature can be divided into, provides 3 different ways for patients to make payment. A patient can provide a payment like a copay, which is considered a prepayment. So any payment made before the patient is or the customer is seen can be made via a special customized link. That link is called LinkPay. That link could be used on your website, and it can be used to collect telehealth visit payment upfront. Besides copays, anything that you want to collect upfront, you can customize that link. It allows you to make that link be customized with your company or practice name, so it's easily remembered and easily identified by your patient. We also have the option of guest pay. Guest pay allows your patients to make a very fast payment using the bill online. They can make that payment from the mobile device, from the computer, from the tablet, in a very convenient way. No need to even create an account. All they need is the patient statement, and they can just render that payment. They can also create an account, which would allow them to not only make payments, but also maybe set up some auto payments, view any past bills or past patient payment that they have rendered, but they would be able to view that entire history. Let's go ahead and get into how a LinkPay would be set up. Our LinkPay, it's a website address. That website address, as I said, can be customized to your practice. That URL link for each SelfPay is found in your templates section of the My Payer tab. It comes pre-populated with custom numbers, which may then be changed to your business name. As you can see in this example here, we have chosen Happy Valley because our test account, our test clinic, is the Happy Valley Clinic. So the landing page is myproviderlink.com/Happy Valley. That link opens a custom My Provider Link website where your payer may process the prepayment. And this is what that website looks like. It requires them to put all the information, and then they can select how they want to render that payment. It can be done via credit card or via a withdrawal from the checking account. Guest pay. Once a statement has been sent out, your patient will be able to use the mailed statement or the e-bill notice via email to make a payment, a guest payment. That does not require them to sign up for any kind of account. It's just a payment that they can make one time. I have divided this slide into 2 portions. As you can see, one is framed in yellow, and that is the process for a mailed statement. So when you receive a mailed statement, your patient can see a payment box in the upper right corner of the statement. That payment box contains the account number and the form ID that is required to make that payment. That patient would then go to My Provider link, which is listed right here also in that payment box. They'd access that website and select Guest Pay. A little box will pop up and they will be able to just type in the account number and the form ID, click Continue, and render the payment. They can pay their bill. One other thing that they can do is they can also select a delivery preference in that same process. That process looks slightly different when an e-bill notice is utilized. When the patient receives the e-bill notice via email, this is an example of one of these emails. This is the body of it. It has a green link in it, a green little icon that the patient can click to view and pay their bill. Once they click it, it takes them to a similar site as the one above, but it's one where they can select to either log in, create an account, or log in, or access Guest Pay. If they select Guest Pay, you can see that that same screen is populated for them to make a one-time payment. As you can see, there's the only difference between the process above with the mailed statement and the e-bill notice is that the patient does not have to provide a form ID or a account number when accessing the e-bill notice or using the e-bill notice to make that payment. Another way of using SelfPay for patients to pay online is to create a My Provider link account. So instead of selecting Guest Pay after receiving the mailed statement and going to myproviderlink.com, they would select Sign Up, which would allow them to create an account. So the pop-up looks as such. It's a sign up pop-up. It requires them to, of course, provide the account number and the form ID as well as all the other information that is required. Using an e-bill notice, one thing that we skip is after we click Sign Up, the account, and I don't know if you can see that, this is slightly small, but the account number and the form ID are pre-populated for the patient since they don't have access to it. And once they have filled out all the required information, they would simply click Sign Up and create the My Provider link account. And this is what the dashboard for our My Provider link account looks like. So once a patient has created an account, they will be able to go ahead and log in and click the Pay button and render payment. And some other nice features of having one of these My Provider Links accounts is that the patient will be able to save a credit card on file so that when they make a payment, they don't have to type in their credit card information. They will be able to just select a saved credit card. They can view the most current payment, the most current bill. They can manage the preferences and how they want to receive the invoice. And they can also set up an automated payment. More about that in a little bit. Of course, they can access the history right here. When they click on history, they will be able to see every single payment that they have made through BillFlash and every single patient statement that has been sent to them via BillFlash also. Let's go ahead and move on. Self-pay reporting. If a patient has made a payment, the source of that payment is online, and that is how it is classified in BillFlash. So you would simply utilize your report tab, which is around reports, select standard reports, and this is pretty much where you can access most of the reports in BillFlash here. As you can see, we have the option of billing. However, since we're looking at payments, we will select the payments tab. And then from the first drop-down menu, you would select source, and the second drop-down menu would allow you to select online. You can click on advanced search, which would allow you to filter down the report even further. So if you wanted a specific date range to see the online payments during just for, let's say, this month, you would be able to click advanced search and another filter window will pop up for you where you can select those date ranges. Once we click search, our report will come up for us. As you can see, the source is online. That's how we know that those payments have been rendered online by the patient. We have the patient's name And we have the confirmation. The confirmation, this number right here, is a clickable number. It's a hyperlink that you can click on. It will pull up, or it will allow you to view that payment receipt. If this list, and this list sometimes if you take a lot of payments throughout the week or the month or even the day, and you needed to find one specific payment, you would be able to actually search this list. You select one of the search filters and type in the name or account number, click search, and then only payments for that specific patient will be generated for you. On to automated payments. AutoPay is another feature of BillFlash, of our pay services, and it allows to automate payments from patients. If you are having a hard time collecting payments on outstanding invoice, know that you are not alone. As out-of-pocket costs rise and cost of living increases, medical expenses are often being put off for another day. The fact that patients are not paying their medical bills is a bigger problem today than it was 10 years ago, as patients' responsibility for medical expenses has risen to a national average of 50% today. I know that these numbers look really high, and when I was doing the research for it, it was really shocking to me. But then I remembered something, and if you don't mind, I would like to illustrate maybe with my story. This is applied in my life. I am the mother of 4 children. My children are older now, but my first child was born in 2001. When I found out that I was pregnant, I remember going to my doctor and, having to confirm it with a test. And I remember paying a $25 copay. And then every visit after that, I didn't have to pay anything. That copay covered all the visits to the doctor, my stay in the hospital, and any procedure that was done. That was it, $25. That's almost unheard of today. My 4th child was born in 2011, 10 years later. Of course, I rendered copays every time I went to the doctor. First thing that's changed. And then after we left the hospital, a few months later, I got a whooping invoice of close to $3,000. And when I added up all my costs between the visits, the procedures, anything that needed to be done, I was way higher than $25. And that, I think we calculated it to over $4,000 in cost to have my 4th child. And that happened just in a time frame of 10 years. Imagine that. $25, 10 years later, it was $4,000. As I considered that, I remember thinking, well, yeah, those 50% are starting to look more real to me now. And because they look more real to me, I imagine that they look very real to medical providers. I'm sure that you have all experienced this. I'm sure that every single one of you is here because you want to learn about what we have to offer and how we can help you prevent loss of revenue. If you think about it, it's no longer $25 that you are missing out on if you're not collecting your patient responsibility, or if your patient is not paying. You are missing out this time around. In my case, it would have been $4,000, and that's quite a chunk of money. At least it is for me. The revenue loss is becoming a really big problem for providers everywhere. Automatic payments have become a standard practice for most industries, and are becoming more and more common in the medical industry. Our AutoPay feature allows you to automate the process of collecting payments for patient remainder balances. Let's take a look at some of the best features of AutoPay and how it can make a difference in your practice. If you are still sending patient payments and waiting for payments from patients, please take a look at this data table that I put together. So if you are sending patient statements, you're most likely not just sending one statement, but another and another. And depending on what your process is for collections, we might be looking at 7, 8 statements. Hopefully not. However, if you set up your automated payments, what triggers the payment is the patient statement being sent to your patient or to your payer. That invoice being sent out triggers the payment that is being withdrawn or processed through that credit card that you have provided when autopay is set up or when the patient has provided during that process. So on average, automated payments allow you to collect your money after just sending one patient statement or payer invoice, customer invoice. You don't have to worry about slow payments or patients not paying their bill altogether because your payment comes in immediately. Now, I don't know how you define a non-payment, because if you continue sending out patient statements or customer invoices and they're not being paid on, somebody has to be supervising that, keeping track of that, or pulling reports constantly and comparing them and singling people out. And if you don't really have a clear process in your practice about what determines or what qualifies somebody for a collection intervention, then you might be really looking at 6 to 9 months before you even get to that point. However, with automated payments, if a payment doesn't go through, as the card is charged right after the patient statement or the payer invoice is sent out, if that payment doesn't go through, it is reported to you as in the decline report as a declined payment. You can generate that report on a weekly basis or a monthly basis, or pretty much after you send those payer statements out, the next following day you can go into reports in BillFlash and generate that decline report, and it will give you a list, a specific list of the payers whose credit card has declined. So no more, and that's why I put burden on the office staff, no more are you constantly and continuously comparing reports of seeing who's received how many statements, or should we still send another invoice before we even start calling? And the list just goes on and becomes really overwhelming. In here, it's just a targeted effort. You don't have to scroll through pages and pages of reports and comparing them. It is very simple, provided to you in the decline report. You will have a list of all the automatic payments that have declined, and you can use that report to contact these payers, these patients, and communicate with them that their credit card was declined and collect that payment, so it does not become a lost revenue for you. Collections and loss. Partial loss of revenue due to collection costs. The older the outstanding balance, the lower the chance collections will actually result. The lower the chance that collections will be even able to retrieve that outstanding balance. There's an increase in loss while waiting for payments as patients continue to be seen and increase the outstanding patient responsibility balance. AutoPay helps minimize that loss by automatically collecting the amount owed and by letting you address declined payments immediately to prevent further revenue loss. And that is our goal. Our goal is to minimize the loss and increase the patient responsibility collection. And keep in mind, if we're looking at 50% of your revenue coming from patients, you don't really have the luxury anymore of sending them a not defined amount of patient statements to collect that payment and hope that that payment will be paid. Auto payments are simple, and automatic payments, BillFlash's auto pay feature, it just allows you to automate the process of collecting payments for your patients, for your patient remainder balances. And it is not something that is new. It's not something that you are trying to introduce. This is something that most of your patients, payers, customers are used to. Most of our utilities require auto pay setups, cable, credit card payments. Some of them will still let you choose, but the majority of these industries require automated payments. So consumers today are set up with these automated payments for everything. This is not something that they're unfamiliar with. This is a very reasonable request of you to make if you wanted to institute this in your business. Let me show you how simple it is to set up this autopay. In BillFlash, under the Get Paid tab, which encompasses all the actions regarding payments, you would simply click on Manage Autopay and then click Add Autopay. And that is how an office administrator would be able to access this feature and get this process started for a patient or a customer. When I was showing you this slide, I mentioned automated payments. This is the feature that allows your payer to actually log into They Might Provide a Link and set this up themselves. So even if you don't set it up, some patients might still be able to take advantage of this by setting it up themselves. And this is what it looks like. They simply log into They Might Provide a Link account, click on Automated Payments, and select Activate. Once Activate is selected, they will be able to determine a maximum payment amount if they wanted to. However, we will continue on with the in-office setup if the administrator were the one setting it up. The maximum payment amount does not have to be set. It can be left undetermined. But it is an amount that you should probably have a conversation with your customer about. That amount should be determined by the payer, by taking under consideration how often they visit the practice, and if any copays and coinsurance are required, like what is their responsibility. And that maximum payment amount should be high enough to cover that cost of however many times, whatever their responsibility would be, of how many times they would be seen, maybe in a month, if they come in on a regular basis. Once that is determined, you would select Card. Once you enter all the information in, like card number, expiration date, and so on, everything that is required, you will be able to click Continue. That brings up this pop-up. It's the pending authorization pop-up, or all about tracking and keeping track of any authorization, any agreements that you have with your payers. We provide you with a way to track those agreements so that in case of a payment dispute, you can prove that this has been acknowledged by the payer. So you have a few options here, and let me show you. Our autopays, this is that same authorization, can be authorized via email. It can be authorized online. It can be authorized via paper. So I selected email right here. You see that you can select to send it to the email on file, or you have the option of checking another email. And this is an example of one of these autopay emails. It pretty much is letting the payer know who's setting this up that it was set up for an account ending in these 4 digits. And then it describes the autopay that, depending on what the maximum amount is that they have set up for the autopay, that they're still responsible for anything that is not covered by the maximum amount. And all the patient has to do is click I agree, activate autopays. That's it. Nothing else. You also have the option of printing out one of our designed paper agreement forms that the patient can sign. Since this form does not contain the entire credit card number, you will be able to store it in the chart if you wanted to. And then, of course, if the patient already created a My Provide a Link account, they will be able to actually log into the My Provide a Link account, click on Automated Payments, and authorize that automated payment if it was set up in the office. Tracking your auto pay authorizations. So once you send that email out, the patient has to click that green button in that email and authorize the auto pay setup. If they have not done so, you will be able to see it as the auto pay line is going to be highlighted in yellow, and it will say pending. By clicking on authorize, you will be able to resend the email or maybe print out one of those printed forms if that's what they prefer to do. But you definitely will be able to see who has not yet acknowledged the email that you have sent them, if that is how you provide them with the authorization. Track your payments, your declined payments. We have talked about tracking if a patient has paid, how many statements they have been sent. We provide you with a solution here. With an auto pay, as soon as a patient statement has been sent out, the credit card is charged. Sometimes the credit card declines. Well, now you don't have to filter through anything. You don't have to go through the entire stack of statements and tracking payments. So you simply go to our Run Report feature, go to Standard Reports, and in the same Payment tab, from the first drop-down menu, you will be able to select Declines. The decline report, it will be accessible to you as soon as auto pay has ran. So after you send your statements and the auto pay ran and the transactions have been processed, you will be able to see which ones have declined. You can select custom from the second drop-down menu and put specific date ranges in, or you can just select all. That's up to you how you want to filter it. But this is one of these reports that you will be able to see. The report is going to be, the status should have to be always declined. So in your report, your status will be declined and the source will be auto pay. And oftentimes you will be able to see a reason for the decline under authorization. Don't be alarmed if there is no reason for it. You're still being alerted that that payment has declined. So whether you know the reason for the decline or not, you still will need to reach out to this patient or to this customer and collect that payment. Implementing auto pay. If you're sitting here and you're asking yourself, okay, well, this is great, but how do I get my patients to agree to it? Well, my very first point here is make auto pay part of your office payment policy. A lot of utility companies, they just don't give you the option, and it's okay. You are doing everything you need to be doing. The money that is owed by the customer or patient to you for services rendered. And it's okay to have an automatic payment policy in place. You're not the only one, I promise. As this has become a problem over the last few years, many providers are implementing it. And many patients recognize the benefits of automated payments. And I don't want to make myself look really bad, but with my 4 kids going to the pediatrician's office, this auto pay has saved my life, because I cannot tell you how many co-pays I have not paid and been sent to collections for because I just frankly forgot. And I'm just not used to tracking all these payments and requests for payment that are coming in. I'll just put them somewhere and they get lost. As with auto pay, I set my maximum payment amount at what I know my copay is, and I never have had any issues since as far as collections go or angry phone calls because I have not paid. And I know that there may be people who don't feel bad about this. I do feel bad if something like that happens. So I know it gives me a lot of discomfort. So this has really helped with my anxiety of missing payments. You can, when you make auto pay part of your office payment policy, make it the default payment for all your patients. Those automatic payments are widely used and even required in so many industries. More and more medical practices are implementing it because of the decline in patient payments and the issues that we're all experiencing. Please share with your patients the benefits of auto pay. They will never be late. they will never be sent to collections, and there's one less invoice for them to track. AutoPay lets payers set a maximum amount, as I shared before, so they still retain control of their finances and their budgets. You can explain to them that billing the insurance is a courtesy your office provides, but that once the insurance has been billed, the remainder balance is the payer's responsibility. And if the patient does not agree with the amount billed, please educate them so they can understand that the dispute for that amount is not with you, the practice, or the provider, but with the insurance policy or the insurance provider. And so that is who they would need to contact. Promoting self-pay to your patients. Of course, it really saves time if patients can just go online and make a payment, don't have to call, don't have to mail in payments. Promoting it will be a great help to your practice. There are simple things that you can do that will make a big difference. For example, you could add a message to your statement, to your invoice, saying online pay is now available. To pay online, please go to myproviderlink.com. You will need your account number and form ID, both of which are found on the statement. You can display information in your office, for example, in your check-in and check-out area. As you can see, we have a little flyer display here that we have designed, and we will be sending you that link after this webinar. So you will be able to advertise it, you'll be able to display that in your office and educate your patients. You can add information about self-pay to your intake documents for patients to view, or add information to your website. The more your payers are informed about the self-pay option, the more likely they will be to use it. And this slide completes my presentation, and I would like to turn the time back over to Tony. Thank you.
Thank you, Monica. It was a great job of showing the benefits there of using BillFlash to simplify those processes for you and make sure that that money is coming in for your businesses. If anything that you saw today was interesting and you'd like to learn more about it, you can schedule a demo by going to BillFlash.com. There's a little schedule a demo up in the upper right-hand corner that will let you pick a time and schedule it directly with one of our outstanding representatives. You can also call us at the number that is listed there on the screen. There's an email address if you'd like to reach out as well. Any of those methods, and we would love to get back in touch with you.